recording will cover rheumatic fever and Kawasaki disease. Rheumatic fever starts from something simple, a sore throat. It's an inflammatory disease that occurs as a reaction to a group A beta hemolytic streptococcus infection of the throat. If you broke it down, a strep throat infection. Rheumatic fever usually occurs within 2 to 6 weeks following an untreated or partially treated strep throat infection. With rheumatic fever, the body has an autoimmune reaction that attacks itself basically, and one of the things it attacks is the heart. So it can cause carditis of the heart, it can cause cardiomegaly, tachycardia, can cause a heart murmur, a new or change of heart murmur. It can affect the skin and cause nodules to form over bony prominences. It can cause problems with joints, making them painful and swollen. Also, the patient can experience a rash, a pink, non-pruritic, so not itchy, macular rash on the trunk and inner surfaces of extremities that appears and disappears rapidly. Also, we worry about CNS involvement, specifically chorea, which are involuntary, purposeless muscle movements. They might also see muscle weakness, involuntary facial movements, difficulty performing fine motor activities. We could see great fluctuations in emotions, going from being super sad to super happy. The term for that is labile emotions. The patient may also have uncoordinated movements of the extremities. They could be irritable, have problems concentrating. All this from a strep throat infection that isn't properly treated. Key things to watch and be monitoring for with the strep throat, obviously the sore throat, a recent diagnosis of a sore throat, or just complaints of a sore throat and not getting it treated properly. Fever, joint pain, murmur, rash, and chorea, those jerky movements can be seen. We're going to be on high alert for cardiac changes because strep, if untreated, is going to damage the heart. Treatment includes antibiotics, anti-inflammatory meds, and long-term prophylaxis. Diagnostics for the strep infection can include a throat culture, a rapid culture that indicates a strep infection, as well as blood work. The blood work is known as the anti-streptolysin O titer, and if it's high, that it would be considered positive, and it's considered the most reliable diagnostic test. And here you got some pictures of the signs and symptoms. Next up is Kawasaki disease. Kawasaki disease is an acute systemic vasculitis. It's considered a pediatric emergency because of what it can do to the coronary arteries. So think of what we're talking about here, acute vasculitis, that's inflamed blood vessels. And the big risk here is coronary artery aneurysms. Signs and symptoms of Kawasaki include a fever, irritability, a non-blistering rash, especially in the peri area, red oral mucous membranes with inflammation, including the pharynx, strawberry tongue with a white coating or red bumps, sort of has a strawberry appearance, bright chapped lips, swelling of the hands and feet with red palms and soles, bilateral joint pain, enlarged lymph nodes, desquamation, which is a medical term for peeling of skin. It looks as if skin is like peeling from a sunburn with Kawasaki disease, as well as cardiac manifestations. Cardiac manifestations include myocarditis, decreased left ventricular function, pericardial effusion, and mitral regurgitation. Clinical criteria for a Kawasaki disease diagnosis is a fever for 5 or more days and characteristic physical examination findings, so seeing those signs and symptoms we talked about. We're also going to be monitoring the patient's ECG and getting an echo done because we're worried about those cardiac manifestations as a result of Kawasaki disease. It's possible that we'll also do other studies lab work to rule out other conditions that may be similar to Kawasaki. Nursing care focuses on cardiac monitoring, IV fluids, and assessing for heart failure. We're going to do daily weights, monitor I's and O's. We're going to try to keep the kiddo as comfortable as possible. Good oral hygiene, cool cloths to the skin, lotion, calm environment, and promoting rest. There are medications. The main treatment is going to be an high dose IV immune globulin or IVIG, and then also low dose aspirin. So this is one of the unique conditions where aspirin is going to be prescribed for the child. Now remember, aspirin's a problem if the child has a viral infection. So Kawasaki disease is a disease where aspirin will be prescribed for the child. Big complication that you want to be watching for with Kawasaki disease is there's a high risk for coronary aneurysms. So the vessels that are feeding the heart itself start having the sort of weak vessel walls that bubble out and are at risk for rupture. That'd be a big complication we're watching.